So what about the characteristics of AVMs? AVMs can be considered superficial. So, intuitively, these are cortical. Deep would be in the brainstem, basal ganglia, such areas. We'll go over more detail about that in a little bit. Most AVMs, about 75%, are superficial. About a quarter of them are deep, but not too many have aneurysms. About 20% have some sort of associated aneurysms, but only 10% would have a feeding artery aneurysm. And the venous drainage, deep venous drainage into the deep system, such as the vein of Galen, basal vein of Rosenthal, about half of them have deep venous drainage. Now, about 40% of AVMs are considered small. Now, small, again, came from the Specimen grading system, where small is considered less than 3 centimeters. But in any case, these are sort of the general, it will give you a rough idea of what a typical AVM would look like. Now, hemorrhage, as you saw earlier, is the most common presentation of AVMs. About half the patients present with hemorrhage. They're usually intraparenchymal, which makes sense because the AVM lives in the actual brain, not in the subarachnoid space like aneurysms, not in the ventricles. So bleeding from AVM is going to be, for the most part, be intraparenchymal. Once in a while, you see AVM bleeding that is intraventricular, but that really only happens because a portion of the AVM happens to reach into the ventricle, or the bleeding is so large that it broke into the ventricle. Subarachnoid hemorrhages can also occur from AVMs, but typically these occur from the aneurysms that are associated with the AVM and not the AVM itself. The one very important thing to remember, even if you don't remember anything else from this lecture, is that if you see an intraparenchymal hemorrhage in a young person, and that there's no exact age cutoff, but I would consider anyone under 50 in this category. So an intraparenchymal hemorrhage in a young person is basically a ruptured AVM until proven otherwise. So if you ever see a young person with an ICH, you'd have to get vascular imaging to work it up, and not assume that it is and this is spontaneous, by the way. We're not talking about traumas. You can't assume that it's hypertensive, for example.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.